Well, why don't we go ahead and start? Kevin's the only one we know is not going to be here. Let's see. Joe, minutes and the secretary's report. Anybody have any corrections? Oh, gosh. I'm going to have to unplug this phone. Hold on, sorry. Everybody give me just a second to yell at somebody here.
If anybody's interested, Emory and Henry is having classes for senior adults. Every year they have an opportunity for you to come to the campus and you pay to stay there and pay to take the classes, but these are online, free to anybody. So if you're interested, send me an email, and they said I could share it with anybody that would be interested.
Sorry, I don't think I can keep this phone from ringing. I don't want to unplug it. Okay, back to minutes. Anybody got any corrections or additions to the minutes?
Move they be approved as presented.
A second.
Okay. All those in favor?
Aye.
Aye.
Anybody opposed? Okay, Joe, anything else? Secretary's report?
No, that's it. I'm going to be attending the regional board meeting Thursday. So
Is that this week?
yes,
Is it in person or?
it's Zoom. It's via Zoom also.
Okay. All
Treva,
right.
I don't know if you're coming to that yet.
I'll be there.
Treva?
You heard her?
Do I have audio?
Yeah, let me
Yes.
see if I,
Yeah, she does.
okay.
Oh, do I have, okay, I have audio. Okay, I'll be there.
Okay, great. Yes. So that's all I have.
Okay, treasurer's report, Treva.
Ooh, we have lots to report. Okay, first of all, Shelley and I had to work on our budget. She came up with.
I'm having a hard time. I can't hear. Anybody else here? We can't hear you, Treva. Too low.
Low volume.
Hold on just a second.
I might have heard her through your microphone, Shelley.
Yeah. Okay. Can you hear me now?
Barely.
Give it a try and we'll see what we can hear.
We have it as it goes, I think. I read all my emails, then I would have known not to show up at the library for a meeting. I would have been.
I want to hold this handset. Glad you can't see me right now.
Okay, I'm on a telephone, so now you can hear me.
Yes.
Okay. First of all, we worked on, Shelley did the budget, and then we got together and tweaked it some. And the main thing that we did was increase the hotspot income And the hotspot expenses, let's see, we raised the income $44,700 and the expenses $39,600. A lot of this was we were hoping would take care of the extra clinic visits for part-time employees. We put another $42,500 in there, and we're just hoping, this is such an unusual year, that this will work. And we did, while we were doing this, we did look at last year's financial statement, excuse me, and the city, county, and the hotspots and the community room and other income came up to like 97% of our budget. And during last year, our hotspot income went up 65%, but our expenses went up 97%. So Shelley and I had talked about sort of doing a deep dive onto what these hotspot expenses are, and they could be, we thought maybe there could be some overcharges, there could be a timing difference about when she's paying and when she was receiving, and we were talked some about setting up a perpetual inventory because these things are just charged and you have to notify the company to drop them, and so we thought maybe some of that was lagging. So that's what we're going to do, just sort of jump in and see if we can find anything that will, keep that more in line. On this month's, on this month's Treasury report, really there isn't much because we were closed. And I think the hotspot income was twice still for the month, and twice what we had set up for it. So we should be okay on that. And the expenses, we were trying to keep around $6,000, which we did also. So I think that's about it. Any questions?
Yes, I have 2 questions. You said your extra clinic visits for employees, how much did you increase the budget by for that?
$42.50.
Oh, 4,250. Okay.
Right.
And then you said
Okay.
the city, county, the community room and hotspots revenues were how much of your budget? What percentage of your total budget?
Hang on.
Did you say 75 or 90? I missed it.
Oh, we were talking about those things, that with the city, county, the hotspots and stuff, that was 97% of our total budget. So that's why we thought we probably needed to spend some time, working on that. We can't do anything about the other items, but that's something that we could work on.
Great, thank you.
Shelley, what are thoughts in terms of looking at that? Or Treva, what?
I think she had said that something about timing differences and trying to get them all lined out to where you have some steady expectation each month. Is that what you were saying, Treva?
I think we lost her.
I think we've lost them both.
Yeah.
I think she was saying something to that effect. I was trying to write down very quickly. Just looking at timing differences and lags and try to keep revenues and expenses more in line with each other or something like that. Just looking at a month to month in a more detailed fashion is what she was saying.
Shelley, are you there? Well, this is going to be fun to have a meeting without Shelley.
Can somebody call her on her phone and tell her we've lost her?
She just popped back up on the screen.
She never left my screen.
Yeah, they might get their Wi-Fi or whatever back. They might get their connection back. Do you want me to call her on her phone?
Yeah, I've got my cell phone. Let me try. Well, she cut it off. She probably saw my number and said, I'm trying, I'm trying.
Okay, let me see. I heard that, and I don't know, my kid said that wasn't true, but one of my friends said that her son got on to go to school, online school in Georgia
Okay,
Monday
I'm
morning,
back.
and it had crashed.
Okay,
Zoom had crashed, evidently. So.
okay, Shelley, you there?
Yeah, I'm back.
Okay,
Sorry, I had a technical issue.
okay. Is Treva with us or?
Yeah.
Oh, okay. Anybody have any comments? We were discussing what in the comment about maybe looking at some things with this hotspot income and expense. I guess I was curious as to what we might do or what you're going to be looking at for options there.
Okay, what we were looking at is just, for example, that we have like 600 hotspots that they have to account for here. So that's why we were thinking about perpetual inventory. Some of them have never been activated. Some of them are, lost. Some of them are just paying customers, but set up some kind of perpetual inventory, and the expenses are related to the hotspots that T-Mobile has in that they are providing service for during that month. So part of it could be timing difference, that when we're picking up the income, and then when the bill comes could be different months. Just some little things like that. Some of them could be things that have not been dropped from T-Mobile's charges. So just jump in and see everything and go over it all and watch it all flow.
Okay, anybody else have any other questions?
Do we expect that the hotspot rental will pick up when school starts for those students that are at home?
I think that'll be that'll account for some increase. I think once we reopen, that will increase it as well. For business people, for people that are going places and need a hotspot.
Our income for this month was almost twice what we had budgeted as income for this month. So it's not the income portion as much as it is the expense portion of that I wanted to check on.
Shelley, we rent them for $2 a day. How much does it cost us?
The library's cost is about $32 or $33 a month, maybe. I'm not exactly, but it's right around in there. That's our cost per device.
Per device, okay. So essentially, we can make twice that if they're 30 days in the month.
Yeah. It's 50. We do by the week. So, and a minimum of a week checkout is $14. It's 7 days.
Okay.
Or 4 weeks, 56. That's what we are going.
Oh, okay.
How we met.
Okay, any other questions? Treva, can we file the, have you got anything else from?
That's it. That's all I have.
Let's file the monthly report for the audit. Now let's jump down to committee reports. Treva, anything from finance?
No, just what we've discussed. That's all I have.
personnel, Elizabeth had indicated, Shelley, I think she was at a doctor's appointment, said she might jump in at some point, but do you know anything that Elizabeth wants reported to the board from personnel?
I don't think she gave me any reports or anything, so I don't have anything.
I don't remember who's on that committee, but have we got anything new on a new board member? I'm trying to look real quick to see who's on that committee. That's Roxanne and Kay. Anything new on new board members or anything?
I believe Deborah gave us some information on that at the last meeting, but I haven't heard anything. Have you, Roxanne?
No, I know she had mentioned someone that was going to be on the board, and I know they are interested, so I don't know if it's just the timing between getting them approved. She had mentioned Mr. Nelson, Dwayne Nelson, and so he is interested.
That's I guess that's nominating, isn't it? I'm jumping ahead of myself, so but anything, Kay or Roxanne, from personnel that we need to report in Elizabeth's absence?
No.
Okay. Kay, on policies, I was in a mediation all day yesterday, and I did not get with Jeff Cranford on that Title VI question you had, and I apologize. I just couldn't get loose yesterday to do it. There were two things you want to, I guess the COVID thing was one, and then the Title VI. You want to deal with the COVID first, and we'll talk about the Title VI.
Yes. Amy, I believe you worked with Shelley on this one about the pandemic response. Is that right, Amy? Shelley, you all worked together on that. So, I can improve on, I just tweaked maybe just one or two things, but I think that since it's coming from Amy and Shelley, that I would like to, and Roxanne agreed, that we put this forth for approval.
Everybody got a copy of that, and I don't know if Amy's, she may have.
I don't know if I wants to say if she was part of it or not.
I think I sent some things, but that was about my level of.
Yeah, she didn't really. I don't know if she's seen what I typed up and gave to UK.
Did you saw that, Amy? Did it come through to you? Are you okay with it? Okay. So Shelley, how do you feel about our passing that today then?
I think that would be fine.
Okay, then the personnel, the policy committee submits that in the form of a motion, the pandemic response procedures.
Do we have a second?
A second.
3 seconds.
Obviously, we could tweak it if we need to, as things seem to change rapidly. But it's probably a good idea to go ahead and get a policy down now, at least to have a starting point. So all those in favor of the procedure being passed, say aye.
Aye.
Anybody opposed? Any further discussion? Okay, on that Title VI, that's a little more involved. If you want to go ahead and submit it, I could talk to my employment lawyer after the fact. Is that somewhat from the city, or where you drafted that from?
I have to give Shelley the credit for putting this together. And Shelley, some of this wording came from county, correct?
That's correct. Yeah.
And I looked for what we had at the city. They have more. This is more than what we have at the city. They expanded over into a brochure and some training for the staff. But did this also come from the region as well? you consulted with Amy on this?
I'm not sure if I sent her what I had from the county, but I just checked with them first and put that together and sent it on.
Okay. And the only thing I did, David, was just basically just some formatting, but Shelley pulled the rest of it together. Could we put it forth? I think she needs to have a policy that deals with Title VI. Could we say contingent upon approval of your colleague?
Well, I don't have any problem just approving it. And I mean, you could tweak it as early as next month if there's something that jumps out at Jeff. And if it's, Shelley, if it's essentially the county's policy, they've thought it through. And okay, what's the name of the CTAS or whatever you get in Nashville that helps the local county and city attorneys. So I'm
CTAS helps the county, MTAS helps the city, yes.
right. So I'm sure it's not anything out of the ordinary, but I wouldn't have a problem if you want to submit it, and I'll get with Jeff. I've got to talk to him about a case anyway, and make sure nothing jumps out at him. If it does, we can tweak it at the end of September.
I think that would be good. So Roxanne, is that okay with you? We talked, the policy committee submits this in the form of a motion for approval, the Title VI assurance policy.
Do I have a second? Everybody's scared. This is.
Yeah, I can second again.
Treva said she'd second again. Can you hear her?
Yeah. Okay. I'm going to assume nobody objects, but let's just say all those in favor say aye.
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 Anybody opposed? Motion passes then. And Kay, I'll let you know if I get anything from Jeff, and I don't think it would be huge to tweak it if we need to. Okay. I've got my papers spread out everywhere. Alpha or Kay, anything else on policy?
No. Do you have anything else, Roxanne?
Oh, ma'am.
No, sir.
Alpha, long-range planning, anything?
No report.
Shelley, anything Deborah had on building and grounds?
She was still asking about the rocks, and we're going to try to get a hold of Bill to see if he's going to do it. She wanted the ones from the city, though. And she had talked to Joey Bernard, and so we're going to get that as soon as we can, get it finished out back where the sign is. But that's all
Okay.
she mentioned.
Anything else on building and grounds that's significant?
Not at this time, I don't think.
Okay. Nominating, and that's Deborah and Elizabeth. Joe, you're on there. I threw Kay and Roxanne into the wrong committee. But Joe, anything new on, I guess, board members? We've still got one vacancy. You heard a little bit from Kay and Roxanne, I think, who had a little information, but anything else that you're aware of?
Not that I'm aware of.
Still working on it. Okay, Shelley, anything on nominating that we need to deal with?
Oh, I guess as long as we're working on getting a board member, that's all there is.
Okay. Treva, purchasing?
I really don't have anything on purchasing, but I think with all the confusion, I left out something that I did want to tell you, how complicated the bill from T-Mobile is. There were 14 pages and we're talking regular typing pages of charges.
Oh.
So tracing all that back to devices it's gonna be time consuming. And so that was just trying to come up with a way to handle all that was what I wanted to say, and I never did tell you how complicated the bill was.
We assumed it was. We all get our Verizon or AT&T or T-Mobile bill every month. And
But there was, I think, 22 items listed on each page and 14 pages, and so it'll take a good while to run all that down, and, so that's all I wanted to say, wanted to add.
okay, if there's money to be saved, we can certainly look at it. Shelley, any unfinished business, I guess, anything would be in the director's report, but anything that we've left undone?
Gee, I can't think of anything, other than what we're currently working on. We talked about the hotspot and everything.
Okay, I guess we can jump to the director's report. Gosh, I've got an absolute mess in here.
I think I've done that too.
Well, I mediated a case with feuding second wife and children from first marriage yesterday, and I thought I had stuff thrown in here to try to protect me from the onslaught. Okay, Shelley, I'm going to let you jump in. I looked at, I hope everybody had a chance to review the options. And Shelley, if you could, can you, the 2 and 3 are reopening, and I didn't see a whole lot of difference, but there may be some. Do you want to kind of lay it out for us?
Actually, option 1 is just staying in place like we are now, but allowing Friends volunteers to come in and sort the donations that we've been receiving, because they're getting backed up. And they also need to do a annual meeting to vote in their officers and things. And a lot of their members do not do Zoom and computer very well. And option 2 is opening it without necessarily limiting it to 25 people, and removing seating if we have to control how many people are staying in the library at a time. We have removed a lot of seating, but there's still some around.
How different is 2 from what we did in May and June before we?
Yeah, I think number 3 is closer to what we did in June, because we're going to have somebody at the doors to limit people and give them a number in the building and stuff like that. Number 2 is just allowing people in, except for having a checkpoint where we take temperatures.
So 3 is pretty close to where we were.
Yeah.
What's your recommendation? Sorry.
That's okay. I can't get used to this Zoom stuff.
I know.
But number 2 is just allowing people to come in as they come in, and not really worrying about limiting the numbers, because there won't be seating around for them to gather. There's no meetings for groups, no study rooms used, no community room used.
And the difference.
Number 3 is
go
limiting.
Ahead. Limiting seating.
Yeah, limiting people into the library 25 at a time is number 3.
Now, we did not do. Remind me. Did we have a limit before?
Yes, we did. We had 10 or 25, I think. Can't remember exactly how many people right now, but we did limit it. We had numbers we passed out to people that came in, and when their time was up, we allowed like 30 minutes if they weren't using the computers. And then if they were still in the building, we would ask number so-and-so to please leave so others could come in. That kind of, that's what we were doing in May.
So 3 is closer to where we were
Yes.
before? Okay, what's your recommendation before I open it up? Well, I want to do 2 things before we discuss it, and this is important, so everybody gets a say. Second thing, and Amy, I assume you're still online, and I know I'll wear you out with this, but it just helps me to know what everybody else is doing. Not that we've got to follow the leader, but I just feel a little more comfortable making a decision knowing what the other regional libraries are doing. So with that as number 2, number 1, Shelley, give us your option. Your preferred option, sorry.
My preferred option was number 2, just to see how it goes for September. And that would be no limit on people in the library, but removing the seating so they can't congregate.
Okay. Amy, if you're still on board, can you give us an update on other libraries as best you can anyway?
Yeah, we have, can everybody hear me okay?
Yeah.
Yeah, okay. Pretty much, if it's an option, we have somebody doing it. We have some libraries that are open completely. We have some libraries that are open limited number of people. We have some that are open just for curbside. So it's pretty much, if you can think it, somebody's doing it.
Is there a majority?
Libraries are Bristol and Kingsport are both open. They limit the amount of time people can spend in the building. Kingsport, and I think they're both taking appointments for computers. Johnson City is still closed. They are doing curbside only.
Is there anybody else besides Johnson City doing curbside only? Greenville? Anybody else?
Greenville, Elizabethton, Carter County is doing curbside only. I believe Hancock County is doing curbside only. Hawkins County is doing curbside only. Sullivan County is doing curbside only. So there's still quite a few.
Probably more curbside than open.
Yes.
Okay. Shelley, go ahead.
I haven't looked at the cases in our county today. Has anyone considered
Yeah, they
that?
come out at 3 o'clock. Joe is our medical expert, I guess, but there's obviously been a decline. That's good. Everybody is an amateur immunologist now, so we all know everything, but I just find it hard to believe that the mask mandate didn't have a lot to do with that. Maybe not. Maybe it was the curve was going down regardless, but I don't think that makes much sense. I think the better thought is that the mask mandate has helped considerably. We're not back in school. Some of the places Amy mentioned are, so we're a little bit of an anomaly there. We're not going until after Labor Day. I don't know. The numbers are much better in the last maybe 10 days, Joe.
Yeah, and I think also there are people in the community now that know people that have been hospitalized or
Yep.
been very sick, so that has helped too, besides the mask mandate. So I think people are more cautious.
It really does. And, probably 6 weeks, 2 months ago, I didn't know anybody, and now Shelley's family, my sister, 2 lawyers in Newport that I know well. Yesterday, I found out about. We all know somebody now. We really do. It's different. I'm going to let everybody chime in because this is important, obviously. But Shelley, I guess my hesitation is even without seating, having so many people in the building worries me a little bit. And what turns you around to recommend that?
I was just thinking that there's so many people in the community that want in here, but to err on the side of health issues, or to be more proactive, I guess, to limit exposure, we could go back to the limiting of people in the library at a time. That might be more safe at this time. And then when the school starts and we see how the numbers are going, we could always do something different.
Well,
Yes.
go ahead.
Oh, so that was my concern. I had sent you an email because I didn't realize your option 2, you did it according to what you were comfortable with. And that's why I had sent you an email asking you if you were going to limit patrons in option 2, or, I thought it was going to be more restrictive than 3. But yeah, so I was just same as David. I was wondering if you removed all the seating, if that was going to keep people from loitering, or you thought it was.
I thought it might. There's some restaurants that have moved out all their seating and you just go in and order and leave. So I was thinking along those lines. And also the county, when you go up there, they take your temperature, but they're not limiting people that I could see when they go in the building. So I was thinking of those examples, set up option 2. But I'm comfortable with going with option 3 if everyone thinks that's a better option.
3 being close to where we were before.
Yes.
Okay, I'm curious to hear everybody's thoughts. I don't have a strong agenda here. I'm trying to weigh all this in my mind, so jump in.
Yeah, I'm more risk. I'm a little more risk averse, and I also wonder if you're going to have, depending on if people come in and wear their masks and social distance, it might not be as big of a problem, but otherwise I am concerned with opening it up to the public if people aren't going to wear masks or social distance or loiter.
Especially since school has not started back yet.
Yeah.
That's a kind of a concern. And then me personally, I'd prefer a softer start, just to kind of see how it goes, and then, kind of see how people are going to behave, and then maybe next month
increase the numbers.
When does Walter State start, Roxanne or Alpha?
We started yesterday.
Okay.
Yes.
So it's a hybrid, classes are hybrid. So most of them are going to be online, but some can have them come in at some point. So those people may be looking for a place to go and sit and do their online classes, because some of them are synchronous where they have to be on video and watch their teachers, and some of them are strictly online. So it's a hodgepodge of a whole lot of different stuff going on here.
Yeah.
Well, if school is a go September the 8th, the reality is you're probably not going to have numbers that reflect any change until later in the month, probably about the time we'd have a board meeting. I mean, at least a couple of 3 weeks. So, I think that's a big unknown here, is what happens when we start school back. And the reality probably is that we're going to know what change, at least to some extent, at least the beginning of what might be the numbers a month from now, when we've got our next board meeting. So I don't know how that would affect what we do here, but the reality is we're probably not going to be a whole lot different for a few weeks. So I don't know. What, anybody else with thoughts?
Well, I'm concerned about when school opens, and I'm concerned about the numbers. So I would sort of weigh in on continuing curbside, and let's make a decision at the end of September meeting.
Yeah, I was thinking more option 3, Shelley.
Yeah. You like option 3?
I mean,
well,
Shelley,
there is opening up I was just kind of considering what the students might need, but we could probably do it curbside just as well as opening. If they will contact us and let us know what they need, we can get it for them.
Shelley, I know this is part of the dilemma with this thing. It's hard to know, but for that period of time that we were open, and what was that, the end of May till we shut down after the 4th of July when Shelley had to quarantine. So maybe 6 weeks or thereabouts. Did we have any evidence of transmission from anybody in the library over that 6 weeks? And I know that's impossible sometimes to know, but either.
It's true. I have a patron that came and came here and got a new card. And then she told us later that she was tested and was positive the day she came to get her new card. So the person that helped her with the card was quarantined for a few days, but her test came back really quickly, so she was allowed to come back because it was negative. And it was limited contact because we took the form outside for her to sign, and they both were wearing masks, and it was really the better place to be would be outside with getting close like that. But and especially if they're wearing protective equipment.
Yeah, I guess
So,
at this, I guess,
curb be the best.
yeah, at this point, I figure we're all passing them in doctor's offices, at the gas station, in Walmart. It's community spread at this point, asymptomatic or symptomatic. So I guess my thing is, we're all exposed pretty much all the time, anytime you're out. Not everybody knows that they're positive, so that's where I kind of thought option 3. But of course, it just depends on how the community behaves as to whether we're going to have more cases. And I've always been the one not to look at the numbers, but to look at the hospitalizations. So, at some point when we didn't have the mandate and they were saying the hospital's open, we have beds, I thought we're going to be in trouble because there's a 2-week lag. And then at some point they were totally full with ventilator patients and we were sending patients away. So, it just depends on how the community behaves. I think that's what's going to get us through this winter. So at this point, whether we do it curbside or open it up to a few people, we're all going to be exposed. Nobody's staying home all the time, 100% of the time. So we're all out and you're passing people that you don't know all day long that are positive, probably. So it's just a matter of being, vigilant, washing our hands, social distancing, wearing our masks. But I still don't feel comfortable with option 2, letting, anybody who wants to come in. So that's just my 2 cents, but we can stay curbside and, I'm always risk averse. I'm excited that my son's not going back to college this fall, so.
Okay, Rob, Treva, do you want to, I may have missed somebody. I'm not sure who else is on, but Kay.
I'm definitely against 2 right now myself. I don't think that's wise. I'm trying to err on the side of being conservative myself, but I think Joe's got a good point that to a degree we're all exposed with what I worry about is just the people that might come in there that's wanderers, if you will, and what that might bring, but trying to protect the staff as well.
I'm sorry, I saw the 6-foot social distance and accessing computers will be limited to an hour, but I think if you have just 25, or wait, sorry, I think 30 minutes. See, I like to option 3 because it was limiting the number, limiting the time, but I'm also good with curbside. If more people want to do that, I just think at this point.
Would it be okay for the board to just say whether they like curbside or option 3?
Before we vote, Shelley,
Yeah.
what your preference is? Well, I haven't heard from Kay or Treva, and y'all don't have to say anything, but chime in if you want to.
I would say instead of you, I would make the mask mandatory if we go with 3. It says utilization, but I think we need to put a sign up, mask required. That is part of what Bill Britton rather said, that we want masks in all public places. And yesterday at the post office, it was interesting. Young man was coming in, he didn't have a mask on, and I said, I said, you need to go get a mask or they're going to ask you to leave. And he said, I don't have one. I just need to know how much it's going to cost me to mail a package. And I said, well, you need to go find out where it's going first. So that was, but I really think that we could go with number 3. Limit the number, limit the time, and require the mask.
The county, neither the county or the city are making masks mandatory, are they, for customers?
Yes, the city is now.
Okay.
Everybody who was at the council meeting, even the council members, we all kept our masks on unless we were presenting.
Okay. Treva?
My only input was, we're doing this now and then we're going to do something for just 2 or 3 weeks and then change again? Would that add to the confusion?
I thought of that too. That's a really good point. But, this is the world we live in now. And, it's stop, start, start, stop. I mean, I don't know how you.
And I think everyone's getting used to that anyway, because it's going to change as the fall comes in and then the winter. I bet you we go back to curbside again.
I think that I would take that bet, Joe, and go to Las Vegas.
This is my recommendation. We stay curbside through September, see how the school's doing, and then open up option 3 in October.
And I guess I think it's going to be the opposite. I think we'll end up closing more in the winter, but I have no crystal ball that tells me that.
I'd say you're right. Because
I think with flu season and everybody moving indoors and the school starting, things may get be a little bit different in October and November, but I don't know that for sure.
Well, limiting the people at this time would be probably good then. Option 3.
That's kind of why I was leaning towards it, is to maybe try, but I know that'll expose all of you too. But
we are kind of exposed to curbside, but not as directly,
Have I missed anybody, or has everybody had a say? I'm trying to count noses here. I'm not sure I've gotten it. I don't know if Elizabeth ever got on or not. She was at a doctor's appointment, I think. Well, why don't we have somebody make a motion for one of the options and vote. The pulse I'm getting is that maybe 3 has a little better support. So if somebody wants to throw that out, we will, and we'll count the votes.
Make a motion that we go with option 3 for the next month.
To be reviewed at the end of September.
And that way, if we need to tighten up or loosen up, we can do so at that time.
Or before, if we need to. And I just had a thought. Well, let's go ahead and vote. And let me write this down so I don't forget the thought.
I'll second that, inserting that the mask is required.
Yeah, okay. Joe, you got that? Shelley? You got that?
Yeah, I do have. Thank you.
And we'll hire, let's see, who's the baddest person on the board to stand at the door to fight anybody that doesn't want to wear one, I guess. I don't know.
David, do you know karate?
No, I don't. Let's see, Alpha's pretty athletic. Rob looks bad, but he's a pussycat.
I saw.
Okay, we have a motion on the floor to accept option 3 with an additional provision to make mask mandatory. So why don't we, Madam Secretary, call the roll. Let's see how everybody votes on the motion rather than do a voice vote.
Alrighty.
You want
Do
me
you get
to
to
call
vote?
it?
David? Yeah, you could call it.
Okay, let me make sure I've got Alpha,
No.
Joe,
Yes.
Treva,
Yes.
Roxanne,
Yes.
Rob,
Yes.
Kay.
Yes,
Did Elizabeth ever get on board? Elizabeth, are you listening?
I think she's here.
Okay, the chair votes yes. So that would appear to pass. Let me make and let's think this through a little bit. Shelley quarantined, Shelley, that was right around the 4th of July, wasn't it? I remember talking to you that weekend. And we rolled back to curbside because of that, and did not call a special meeting of the board. And I guess my thought was that was sort of an emergency situation, and under the authority of the director, with input from the board, that I thought that was probably the best way to handle it. What would everybody think about a motion that, if in the discretion of the director and the chair, that we need to roll back this approved policy before the board meeting in September, that the chair and the director have the authority to do that. And I'll be honest with you, I have no idea if anybody wanted to question us on Robert's Rules of Order, whether or not that's appropriate. But we've never lived through a pandemic before either, I guess. And I'm not opposed to calling a special meeting again, but it's just a lot of trouble. And if things are relatively dangerous and you need to shut it down immediately, trying to get all 10 of us together is problematic. So what is any discussion on that motion to in addition to the approval of the policy?
I think it's great, and I'll make that motion.
I was going to say, would it be easier if I just amended my motion to add that in?
It probably would. Roll it into.
And make it easier for you when you type it up?
Yeah, because Kay's mask mandate was
With the
rolled.
mask in there, yes.
Yeah.
I'll amend my second to include that.
Does anybody have any problems with that? And I'll assure you, I'm not trying to be a authoritarian board chair here. It's just really hard to move on a dime when you got 10 folks. I guess you can, but it's not easy. And having lived through it once, where and you know, here we were the 4th of July weekend. We didn't know what was going on with Shelley's exposure. We didn't know who was exposed, who would be exposed. Everybody was doing something for the 4th of July, and it was just that we just didn't have time to do anything other than roll back to curbside. So if anybody has any objection to that being included in Roxanne's motion and Kay's second, let us hear from you. All right, I'll assume that means that's part of the motion and the second. Okay, Shelley, anything further for a director's report?
I wanted to invite y'all to come by the front sidewalk here and look in the windows at the display from the Tennessee Library on women's voting, traveling exhibit that they sent out to a lot of libraries and different places. So it's really nice. And I have I was contacted from Howmet to submit for a grant, and I did that, but I'm waiting to hear how that goes.
Any other new grant information? I think we covered that last month, but anything new?
Yeah, I didn't know if Howmet was on last month or not.
Okay, anything further on the director's report?
I love what is that, animal? Is that a squirrel?
I don't know if it's a squirrel or a rat, but it's cute.
Have you had anybody return anything? Oh, it's not starting yet.
It'll start next week, and I want to go ahead and do that. And then the second week, even though we are on curbside, to reinstate fines, collecting fines, so that I have 2 weeks to get the note out to our patrons and stuff that their items will be fined if they're late after the second week of September.
Shelley, do you want to talk anything about the OLA hotspots that we talked about?
Oh yeah, I'm glad you reminded me. We already have a donation for the hotspot to be used in a computer lab from a senior citizen. I don't know if she wants to be known, so I won't mention her name, but this lab will be for students. I can't remember which school they're in, but it's Ola Lakeway that's promoting it, I believe. And I think it's a really good option for the library to reach out to the community, and hopefully maybe some other ones will want to open some labs, and we can work with them too. It'll, the one device will connect up to 15, supposedly 15 different devices like computers and laptops, and they're setting up their lab now, and hopefully we can, it will help them with their students that can't get Wi-Fi at home.
And then that's set up they have their own site. They're not coming to the library, are they?
That's right. They're going to have their own lab at school, I believe, at the school they're in.
I thought that was a good community outreach, and Shelley worked with them on pricing in case another group would like to come in. We talked about it in policy, but I felt like it was an internal decision.
That's awesome.
Okay. Any new business before we get to Amy and the regional report?
David, I would think as a public service, could Shelley post some signage that encourages people to take their flu shot? I mean, I think, or on the, just a little PSA on our website, because that is something that's going to be very vital for everybody to get their flu shot this year.
Shelley, what do you think of that?
I can do that. I think I can do that on Facebook and on our website.
Good. I'm not sure, Joe, have you heard, is there going to be a shortage of vaccines this year?
I haven't heard, but
Okay.
I'm sure that people like myself who don't take a flu shot will be taking one this year, so they're going to need a lot.
Okay, thank you.
I heard something on NPR this morning that said that they had ramped up the production of the flu vaccine because they wanted more people to take it. They didn't know if they would go to the doctor to take it, so they don't know where they're going to distribute those, but they had increased the number of flu vaccines that were going to be available.
Yeah, I think in anticipation of exactly what I said, people who don't take them regularly will probably take them this year.
And I don't know how many this applies to, but if you're of that certain age, there are two strengths for it. There's the regular flu shot, and then if you're over whatever that magic age is, I think 60, 65, somewhere in there, they have a stronger version. So if you qualify for that, and I don't think anybody on here qualifies for that, but if you do, then you might want to think about inquiring about that.
Okay, Shelley, see if you can post something both on the website and maybe in the window. Any other new business? Amy, regional report?
Okay, I don't have too much. We have the CARES grant. If you applied for the CARES grant, they are working on the contracts right now. So you should be seeing the contracts come to you hopefully this week or next week. I know they're finalizing some of those. So once you get that, get it signed and send it back. And as soon as we get it fully signed, we can you can start getting reimbursed.
Is this again for supplies, Amy?
Hmm?
For supplies? Okay.
Yeah, or whatever Shelley wrote the grant for. I'm not sure. Everybody's is a little bit different.
I asked for Chromebooks and supplies.
Cleaning supplies?
Yes, cleaning.
Thank you.
Okay. As of right now, the executive order that allows for virtual meetings expires on Friday at 11:59 p.m. I have not heard anything about an extension, but as soon as I hear if Governor Lee is going to extend his order, I will get an email out to everybody. But as of right now, it expires on Friday at 11:59 p.m. And we will have to go back to in-person meetings again, unless he extends it. Hopefully he does. He likes to wait till the last minute on this. The past couple times it's been a day or two before the expiration. So, so just because we haven't heard anything at this point doesn't mean it won't happen. So I will keep the directors up to date on what I hear on that. And we have some training coming up in October. We're going to do some grant writing training. We have a day-long grant writing seminar. It will be virtual because trainings can still be virtual, just not meetings. We have Casey Williams from Blount County Public Library. She will be coming in to do grant writing for libraries. And she is also she teaches grant writing at the UT School of Information Science. So this is something she's well versed on, and she has some great information. So other than that, we will keep you up to date with what kind of training we're going to have. And if you have any questions or needs from me, please let me know.
Most, I know, Amy, you get all these questions from me, but are most of our boards still meeting via Zoom or in person, or is it a mix?
It's a mix. I probably have, there are more Zoom ones, but I do have quite a few that are meeting in person. Some of them have never done anything but meet in person. So, so it's kind of a mixed bag. Most of the larger libraries are meeting via Zoom, and is pretty much how it divides. Some of the smaller ones are meeting in person. So.
Well, unless we hear from the governor, I guess we will see everybody in person next month. Unless things change as they do as we go through this. Okay, anything we've missed or anything else?
Yeah, I had a question for Amy. Amy, are we up to date on all our standards and all the contracts and everything that you require?
As of right now, the only thing outstanding is the maintenance of effort document, and that one isn't due until October. Otherwise, I believe we have everything up to date. The data collection will open, I believe it's September 1st. So, so you'll be able to get working on data collection at that point, but I believe those are the only two outstanding things right now.
I just
Okay, and then
sent a copy of OE to David or to Bill Britton, and it'll get to David soon.
I hope just to sign it.
Yeah.
Okay, anything else?
And this is just one other thing on the side, and Shelley, I'm going to see, and maybe you can look to see if you see some posters we can post on proper mask wearing, because the one thing is we have this mask mandate, but many people are just wearing it under their noses. So the key is to put it on the bridge of your nose. So, you know, I just was going to I'm sure you all are doing it. I just wanted to let you know that if you're not wearing it properly, then you might as well not wear one, because you're not doing anybody a service by wearing it incorrectly. So
I can do
Okay.
that.
yeah, I look too. I just thought I just see a lot of that going on, and we just kind of